I am Dr. Natnael Alemayehu from Ethiopia. I was working in one of the pilot oncology centers south of the capital, which is the Hawassa Oncology Center. I am grateful to be here. In Ethiopia, maybe you can, the worldwide mortality rate of cancer, according to Globocon, 30% of the world mortality is caused by cancer. The same is happening in our country as in other developing countries. Around 5.8% of the annual deaths are caused by cancer. And as it is mentioned earlier, there is an annual incidence of 60,000 cancer cases annually. And among these, the sad thing is 44,000 die in the same year. Which indicates that the late presentation of the disease. After saying this, let me say the challenges. As in other developing worlds, the cancer care in my country is centralized. The main reason for this centralization is the challenge. One of this challenge is infrastructure, which is expensive, and the medical equipment, which are also expensive. And in addition to that, the lack of skilled manpower is the main reason for these activities to be centralized. The same was happening in my country. But in the past 3 years, one pilot center was established out of the capital, which is going to address the growing burden of cancer in my country. And I was grateful to be part of this expansion program. And when you mention about the lack of manpower, the importance of Merck Africa Oncology Fellowship comes. Because Merck Africa Oncology Fellowship Program will enable us and hopefully the rest of Africa to address the large population of each country, especially to decentralize the activities, since one of the main challenges to reach the population was lack of manpower. So I am very grateful to be part of this Oncology Fellowship Program. The Merck Africa Oncology Fellowship Program will enable me to reach to the unaddressed part of the cancer burden. As it's already mentioned, in my country there were only 3 active radiation or clinical oncologists. But nowadays there were 4 graduates, new graduates, who are joining the cancer care. So after completion of my training, I will be maybe the first medical oncologist to serve the around 18 million population, which is covered by my hospital. So this will give me a good opportunity to interact the challenges that I was facing in the past. Because as you know, Tata Hospital is the best place to learn. With a lot of patient flows, you can get a lot of knowledge. After completion of this program, hope I will be an asset to tackle the cancer burden in my country. As part of medical oncology training, I was getting chances to rotate into different units of the medical oncology, especially the solid tumors and the adult hematolymphoid. Besides that, I was also interested in gaining knowledge of some of the preventive activities, since in my country, since most of the cases are presented at late stage, and this may indicate a poor awareness program and poor preventive activities. So I was also introduced to the preventive oncology service in Tata Hospital, which will give me a more efficient capacity to address the sources of cancer burden, which is by preventive activity and awareness creation. The Merck Africa Oncology Fellowship Program is the best to get, especially if you are trained in Tata Memorial Hospital, because Tata Memorial Hospital is the best cancer center in Asia. So with a lot of cases coming into Tata hospitals, you will be introduced and you will be getting chance to address each and every kind of cancer. So this program will enable those who want to come into this program and those who are also in the program. So I would suggest all the new coming fellows who are going to attend the Merck Oncology Fellowship Program to dig and to take the best out of this program. I would like to thank the Merck Foundation for giving me this opportunity to enrich my capacity so that I can handle the cancer cases in my country, because my country is in great need of medical oncologists who can address the preventive, diagnostic, treatment and palliative care activities of cancer patients. So I'm thankful to say Merck Foundation for giving me this opportunity. And second, I would like to thank Tata Memorial Hospital to give me this opportunity, especially the academic dean, Professor Kailash Sharma, for giving us a good advice and opportunity in this program. Next to that, I would like to thank all the physicians, the consultants working in the medical oncology department, especially those working in solid tumor 1, and specifically I want to thank Dr. Gynae Ghosh for teaching me the best knowledge she had, and even by acting as at the same time as a translator and as a lecturer. And I would like to thank all of the Merck families for being part of this. Thank you very much.